So as far as patients that present to us, generally they will reach in and we will do a telephone screening for them, looking at their mental health journey and medical situations as well. So generally speaking, we ask patients regarding their medical situations. So things like heart attacks, strokes, uncontrolled blood pressure, dialysis or kidney failure, liver failure, or schizophrenia. Those individuals would need to have some prior medical authorization in order to get the therapy. As far as mental health disorders, the ketamine therapies are highly effective for mood disorders, but they don't work so well for personality disorders. And frequently, personality disorders are an offshoot of underlying mood disorders, and they are basically presentations of individuals and how they behave outwardly as a result of depression or anxiety. So those are learned behaviors and they begin to be incorporated as habits. Those are the types of disorders that are better treated through the psychotherapist in the form of cognitive behavioral therapy to correct their behaviors. But ketamine in general works very well for any type of depressive disorder. It is rapid acting, it is robust. So individuals who meet criteria for depression, whether it's recent onset or whether it's refractory to all of the treatments, those are the individuals that respond best, and it's very consistent. 70% of treatment-resistant patients have either significant improvement or they actually have remission where they have failed multiple other traditional medications prior to that. In fact, the STAR-D trial back in 2006 which was a meta-analysis of how basic traditional antidepressants work, evaluated all these different antidepressants to see exactly, how a person would respond to depression. And it was found that really only 1/3 of patients had response to the traditional antidepressants within 2 months, and that the other 70% were vastly undertreated. And frequently, that 1/3 that responded initially to traditional medications actually would relapse. And so it would not only was there a high failure rate, but there was also a lengthy period between the time you started therapy and the time that the medication actually worked. In addition to the fact that there were numerous side effects from these medications, such as weight gain, sexual side effects, hair loss, and something called anhedonia, which is basically emotional blunting, where the individual doesn't feel anything. So they don't feel happy, but they don't feel sad. They just don't feel motivated. The other aspect of traditional therapies is that they actually don't treat symptoms of depression that basically are the primary problems that patients come in with. It's not just about sadness. It's not about tearfulness and just hedonistic tone being low, but rather motivation and reward being low and cognition. Most people complain of cognitive deficits like brain fog, in addition to fatigue. And also there's wellness parameters such as self-esteem, low self-esteem, ruminations, negative self-talk, self-sabotaging behaviors. All those types of wellness parameters are not treated by the traditional antidepressant paradigm. So patients who get medications frequently may feel less sad and not cry as much, but they still can't go back to work. They still can't function. They still can't have fulfillment in their lives simply because of the wellness side of their brain not working. And so what ketamine offers is an option to actually improve those wellness factors in people's lives, which includes increasing motivation, increasing reward, increasing feelings of wellness and hope and self-esteem, as well as squelching the ruminations and the negative self-talk that people frequently have when they're depressed.